Hello everyone, thanks for joining us today. Let me start as usual with the update on the COVID statistics. An additional 66 positive cases were confirmed yesterday. That represents 1% of people who were newly tested, and it takes the total number of cases in Scotland now to 19,877. The full Health Board breakdown will be available later as usual, but my provisional information is that 14 of the 66 new cases are in Tayside, where of course we're dealing with the cluster involving the Two Sisters food processing plant. 15 are in Greater Glasgow and Clyde, 17 in Lanarkshire and 5 are in Grampian. These are Health Board areas in which we've been dealing with clusters in recent days, which is why I'm specifically mentioning them. But the remainder of today's cases are spread across 5 other Health Board areas. I can also confirm that a total of 248 patients are currently in hospital with confirmed COVID, which is 3 more than yesterday. And 1 person is in intensive care, which is 1 fewer than yesterday. I'm also able to confirm, and very pleased to do so, that yet again in the past 24 hours no deaths were registered of patients who first tested positive over the previous 28 days. The number of deaths under that measurement therefore remains 2,492. Of course, that total should remind us of the impact this virus has had, and I once again want to express condolences to everyone who has suffered loss. And as always, I want to thank everyone who's working in a whole variety of different capacities to help the country through this pandemic. Today I want to cover 3 issues before the Chief Medical Officer and I take questions from journalists as usual. Firstly, I want to recap on the decision we confirmed yesterday to ease restrictions in Aberdeen. I'll then talk a bit more about today's figures with a particular emphasis on the cluster in Cooper Angus. And I'll close by briefly talking about the issue of face coverings in schools. Now, over the past week, there has been a continued decline in the number of new cases being recorded in Aberdeen and more widely in the Grampian Health Board area. We were therefore able to agree yesterday the lifting of restrictions which were put in place for Aberdeen City 2.5 weeks ago. That means that from today, our advice on travel and on meeting up in people's homes is the same in Aberdeen as it is in all other parts of Scotland. We're no longer recommending that people in Aberdeen should stick to a 5-mile limit when travelling for leisure or recreation, and people in Aberdeen are now able to go into other people's houses. However, and this is obviously important, they must continue to stick to the national guidance on this, and just to remind people what that is, only 3 households can meet indoors, and the maximum group size indoors is 8. We've also set a timetable for the removal of restrictions in relation to hospitality in Aberdeen. Hospitality premises will be able to reopen from Wednesday this week, that's the 26th of August, but they should only open once an environmental health check has been completed by council officials. Any hospitality business owners in Aberdeen who intend to open on Wednesday and who haven't already been contacted should get in touch with Aberdeen Council to ensure that they go through the appropriate checks. In addition, last Thursday I set out a number of nationwide changes to lockdown restrictions which take effect from today. All of these changes should follow the relevant guidance. I announced that from today some outdoor live events can now go ahead with physical distancing, enhanced hygiene and restricted numbers. Organised outdoor contact sports can resume for people of all ages. Driving lessons can also resume, and indoor face-to-face advice services, for example, Citizens Advice Bureau and Welfare Advice Services, can also reopen. Yesterday's announcement means that the majority of today's changes also apply to Aberdeen. So it's now possible, for example, to have a driving lesson in Aberdeen or to play a contact sport outdoors. There are, however, 2 exceptions to that. On Thursday, I announced the nationwide reopening of premises and services such as bingo halls, casinos, fun fairs and bowling alleys. Casinos must remain closed in Aberdeen until Wednesday. Other services can reopen, but without selling food and drink for consumption on their premises. They can only open for the sale of food and drink from Wednesday. And they, like all other hospitality premises, should be subject to an environmental health check. If business owners in Aberdeen are in any doubt about the status of their premises, they should contact Aberdeen Council for further information. I'm sure that the lifting of these restrictions after what must have felt like a long 19 days will be very welcome in Aberdeen, and I want to thank all partners there for working so cooperatively with us during a difficult time. And I want to specifically thank local health protection teams for the immense amount of work that they have done and continue to do to make sure that this outbreak is under control. But most of all, I want to thank the people of Aberdeen. These restrictions have been effective in beating back this outbreak for the simple reason that you have all complied very well with them. And that's also the reason that we're now able to lift these restrictions. I know how difficult this last 2.5 week period must have been for everybody in the city, and you have my grateful thanks for that compliance. I now want to touch on today's figures, but specifically the figures for Tayside. As I mentioned earlier, and as we've been reporting over the past few days, we're currently dealing with a major cluster of cases based around the Two Sisters poultry processing factory in Cooper Angus. As of yesterday, there were 110 positive cases linked to that cluster. 96 were employees in the factory and 14 were contacts of theirs. The factory remains closed and contact tracing continues. This is a very significant outbreak, and I would expect to see the number of cases rise even further. Over the past 5 days, the mobile testing unit at the Two Sisters plant has tested almost 900 people, and other testing sites in Dundee, Forfar and Perth have tested more than 1,600 people. There is, however, and this is an important point, at this stage there is no evidence so far of wider community transmission. For example, I mentioned on Friday that people in the Cooper Angus cluster might have had links to 2 other food processing factories in Tayside, but so far no other cases have been identified in relation to those factories. And so once again, I want to thank everyone who has been involved in the contact tracing operation, and indeed everyone who is helping with the wider response. Finally, and importantly, I want to stress that our guidance for employees of Two Sisters and their families remains unchanged. If you work at the plant, you and other members of your household, including children, must self-isolate until the 31st of August. Support from local authorities is available to help you do that if you need it, but sticking to that guidance is absolutely fundamental in helping us to keep the outbreak under control and to ensure that we continue to be able to say, as we can now, that there is no evidence of wider community transmission. The other cluster I want to briefly update on is at Kings Park School in Dundee. 22 cases in total have been identified there, 17 members of staff, 2 pupils and 3 community contacts. Following contact tracing, children from 2 other Dundee primary schools have also tested positive. Contacts of those children or their parents and carers have already been alerted by health protection teams. For Kings Park School, advice was issued on Friday, which remains in place. All staff should self-isolate for 14 days from the last day that they were on site, and all pupils should self-isolate for 14 days from Thursday the 20th of August. Anyone who lives with a pupil, such as parents, carers or siblings, should also self-isolate for 14 days from the 20th of August if they are unable to maintain physical distancing within the household. Testing is available for all staff who work at the school, and support and advice is available for everyone involved. But once again, let me stress the importance of these rules on self-isolation and thank everyone for sticking to them. Self-isolation is a crucial way, perhaps the most important way of all, of keeping clusters like this under control and mitigating against wider transmission in the community. Now, the final issue I want to cover today is face coverings in school, which I know is attracting a lot of attention and sparking a lot of debate. Over the weekend, the World Health Organization issued new guidance on this subject. It said that young people over the age of 12 in schools where physical distancing was not possible and in areas of high transmission, then face coverings should be recommended. I said last week that we here in Scotland were looking closely at this issue and taking advice from our expert advisory group. So by way of update today, I can confirm that the Education Secretary is in the final stages of consulting with teachers and local authorities on a recommendation for the use of face coverings by staff and pupils in secondary schools when they are moving around in corridors and communal areas. We're consulting on this specific measure because, firstly, mixing between different groups is more likely in corridors and communal areas. increasing the potential for transmission. Secondly, crowding and close contact in these areas is more likely, and voices could be raised, resulting in greater potential for creating aerosol transmission. And finally, there is often less scope for effective ventilation in these areas. So this is a position, if we conclude it, as we expect to do, that would reflect and actually go slightly beyond current WHO guidance. We're also considering the position on school transport, and I'll set out, or we will set out our conclusion in the next few days. But we're not currently consulting on any proposals to wear face coverings in classrooms. And that is because there is greater scope for physical distancing in the classroom, and face coverings are, of course, more likely to interfere with teaching and learning. I would emphasise, however, that where there are outbreaks, it does remain an option for incident management teams to recommend more extensive use of face coverings if they believe in a particular area that is required for a period to protect public health and reduce the risks of transmission. And more generally, the reason why we are consulting at this stage on a limited use of face coverings, and indeed the reason why we have been able to fully reopen schools, is because of the relatively low levels of transmission we currently see in the community. And that highlights a fundamental point. The best way to ensure that schools can stay open safely and that businesses can reopen and stay open is for all of us to play our part in keeping transmission rates within the community as low as possible. And the way for all of us to help do that is by sticking to current guidelines, and so that, as always, is the point I want to end on. This is vital everywhere, but it is especially important in relation to indoor settings, which we know pose a higher risk of transmission. When you're indoors, no more than 8 people from no more than 3 households should meet up. These rules apply whether you are in each other's homes or in a pub or a bar or a restaurant, and you should at all times physically distance from members of other households and remember to wash your hands and hard surfaces. Doing all of that will reduce your risk of getting the virus, and it will also make it less likely that you will pass the virus on to somebody else. And it will also, and this actually is worth bearing in mind right now as our test and protect teams are working across the country, following that guidance will also mean that you are less likely to become a close contact of someone with COVID. And that means you are less likely to be contacted by Test and Protect and advised to isolate for 14 days if someone you know gets the virus. So please think about the decisions that you're making, and please also help us to get these messages across to your families and to wider networks of friends and colleagues. And at all times, remember facts, the 5 golden rules that we must all be remembering as we go out and about. Face coverings in enclosed spaces, avoid crowded places, clean your hands and clean hard surfaces regularly, 2-metre distancing remains the overall rule, and self-isolate and book a test if you have symptoms. These 5 rules will help all of us play our part in keeping transmission in the community of this virus low. It will help to enable our Test and Protect teams to do their work effectively, and ultimately it will help protect the NHS and it will help to save lives. So my thanks to everybody for cooperation with that, and please continue to encourage everybody you know to follow all of these rules. Thank you for listening. I had quite a lot of ground to cover today, so thank you for bearing with me. We're now going to go straight to questions, and Chief Medical Officer will join me in answering them. First question today comes from Jamie McIver from BBC Scotland.
Good afternoon, First Minister. Schools were well aware of the problems and challenges associated with crowded corridors. Should guidance on face masks have been in place for August the 11th? Secondly, BBC Scotland has spoken to a number of people in the Central Belt who've been directed to test centres in England and Northern Ireland for COVID testing. One person was told by the NHS Scotland helpline that there's currently no testing available in Scotland. Are you aware of any problems with testing in Scotland at the moment?
Okay, Jamie, thanks. Let me take both of those questions. Firstly, on changing guidance, and we've seen guidance on a whole range of issues change over the months we've been dealing with this pandemic, and that will continue to be the case. And when we change guidance in light of latest scientific evidence, understandably, so I'm not complaining about this, there will be people who say you should have done it earlier, but we are trying to make sure that all of our guidance is properly considered, informed by the best evidence we have, but also adaptable. So the guidance that was in place for schools going back on the 11th of August was, as I've covered here before, informed by the input of our scientific advisory group. We have been considering over the last few days, as I've said here a couple of times previously, specifically whether that guidance needed to be changed on face coverings. Over the weekend, we have seen updated guidance from the World Health Organization, which is why we are in the final stages of consulting on the proposition that I have set out today. This is always going to be a case of making sure that our guidance on any particular issue is as up to date as possible, that it is responsive to changing circumstances, but also that it is proportionate. And we know, and we are trying to get the balance right between maximum protection against transmission in schools, but also enabling young people to learn and be taught in ways that are conducive to them having a good school experience. But we will always take care to get this guidance right, and that applies to face coverings as it does to other aspects as well. On the issue of testing, I am aware of some issues with the booking system this morning. We know that we have, and I think this is a UK-wide issue, but obviously I'll talk specifically about Scotland. We have seen exceptional testing demand over the weekend, and therefore we are looking right now at how we ensure that that demand is properly and appropriately managed. And there may have been, and I say may have been because my officials as I came in here were still trying to understand this fully this morning, and I'll get an update as soon as I leave the podium later on. There may have been some technical issue with people in Scotland. Instead of being directed to the next available slot in Scotland, were directed erroneously to testing centres in England, and we're working to ensure that that is resolved. So I would say to people, our testing system is obviously working, it's working well, but as demand increases or at periods of high demand, bear with us as we resolve and understand any particular issues. That's the information I have at the moment. Obviously, I'll get an update from my officials after I've done this briefing, and if there is more information that we can give later on in the day or more updates, we'll seek to do that as quickly as possible. Gordon Cree from STV.
Thank you. Firstly, just to pick up on something you just said there, you said that there was a exceptional demand for testing over the weekend. It might be useful to know why that might be. Just a few weeks ago, the daily case numbers in Scotland were particularly low, and we were even hearing about the elimination strategy. But over the last few weeks, the numbers seem to have ticked up a bit and been at this kind of 1% figure every day. Does that suggest that something has gone wrong? And if so, what? And if I can ask the Chief Medical Officer, despite that slightly higher level of daily cases, we haven't seen any uptick in hospital admissions or deaths, which is fueling a kind of narrative among some people that the virus isn't as lethal as it previously was. What can you say about that?
I'll head over to the CMO in a second. I used the word exceptional, and we'll look at the numbers later on, but we seem to have had higher demand, which is perhaps not surprising over the weekend, and we are looking right now to properly understand that. I don't want to go too much further and too far into anecdotes, but I've heard a lot of anecdotes over the weekend of kids with coughs that their parents are taking them for tests. Most of those tests, as I understand it, are not COVID, but we're going into a part of the year when people could have other illnesses and viruses that present with similar symptoms to COVID. So we would expect to see demand for testing increase as we go into the autumn and winter, and there will undoubtedly be peaks in that demand period, but our testing teams are working to make sure we understand that as we continue to build the resilience of our testing system and the capacity of that as we go into the next period. So just to take on very directly some of the terminology you used there, nothing has gone wrong other than we are dealing with an infectious virus and a global pandemic of that infectious virus. And as we started to come out of lockdown, it was always likely to be the case that we would see more cases, because as I've said many times here before, as we locked ourselves down, we locked the virus down. So as we unlock ourselves to an extent, we unlock the virus as well. It is still our objective to suppress this virus as far as we can, to as close to an elimination level as we possibly can. But clearly what we need to do to achieve that, as we release the lockdown restrictions, the nature of that changes. What I would say is that, and again, you've heard me say this before, the total number of cases every day is important. If it wasn't important, I wouldn't stand here and report it. But there's a couple of other things that probably are more important to look at, because the total volume of cases will vary depending on the number of tests we do. The more tests we do, the more cases we will find, and the fewer tests we do, the fewer cases we will find. So what I look at first every morning when I get these figures is the percentage positive. And what we see is that is hovering around 1%. Some days it's slightly below that, some days it's slightly above that. But as long as it is hovering around there, we should take a bit of reassurance from that. And let me remind people of what the WHO define as an outbreak under control, which is that testing positivity is below 5% for a 2-week period. Now, clearly at this stage, we are well below that. The other thing that we look at very closely are the number of the daily cases that are connected to known clusters and outbreaks. And over the past few days, and obviously I and others have been looking very closely at this over the weekend, a significant number of our cases have been attached to the known clusters we've been talking about. So for the past couple of weeks, that's been largely Aberdeen, with slightly smaller clusters in Lanarkshire and North East Glasgow. Over the past 3-4 days, that has been largely the Cooper Angus Two Sisters cluster. So the reason why I've set out quite strongly today, and I should always put in the caveat that these are always changing circumstances, but right now we don't have any complacency about this, but we can take a bit of assurance that as of this stage, the Cooper Angus cluster does not appear to be seeding wider community transmission, but it in itself is responsible for a large number of cases. So these are the two contextual points that I would ask you to consider when considering that overall number of cases. 66 cases across the whole of Scotland is still a very low number, and our task, all of our task, because it is down to all of us, is to do everything we can to keep it there. I'm sorry for that lengthy answer, but it's important that we try to give as much context to these figures as possible. On whether the virus is changing in nature or severity, I'll hand over to the person who's qualified to answer that.
What we're seeing across the country just now is a picture where we've had a larger number of cases than we've had for some time, but driven by very localised outbreaks across the country. We've had first the Aberdeen outbreak that we've been dealing with, more recently the Cooper Angus outbreak that we've been dealing with, and added to that, some numbers coming through across the rest of the country. Now, what's interesting, if you look at the type of age groups that we're starting to see now, there has been a shift. Now, that's maybe not surprising. Given that we've started to open up the country, people are re-engaging with each other, what we're particularly finding is that a greater proportion than before of the people who are presenting are in younger age groups than perhaps we saw 3 months ago. Now, why is that important? Well, it's important because we know that younger age groups tend to have a different course and pattern in terms of their infection course. Doesn't mean to say that they won't become ill, but it's less likely than perhaps some of the older age groups that we're seeing. And there's always a delay in terms of the progression of any illness from the point of diagnosis through what tends to be a first phase, and hospitalisations or even ICU admissions tend to come after a delayed period, some 2 to 3 weeks later. So at this stage, we're not seeing any of that increased disease activity translating through directly to hospital admissions. It remains a possibility, but there is no evidence at all at this moment in time, either in this country or elsewhere for that matter, that the pattern of the severity of disease is changing on a global basis. What we are seeing, however, is that there are some elements, particularly of the European experience and some of the strains that we're seeing, which are particularly active in Europe, which may be more transmissible than the original strains which became apparent in Asia and particularly Southeast Asia. So that's something that we are keeping quite a close eye on.
Thanks, Gregor. Peter McMahon from ITV Border. Peter McMahon.
Am I unmuted?
Yep.
Right, okay. First Minister, ITV Border has been speaking to someone who owns some pubs and hotels in the Dumfries and Galloway area. And he says that because of the ban on music, they can't provide the atmosphere that their clients want and like. As a result, he's had to close one of his premises. He says people are either staying at home or possibly even some of them are crossing over the border to England, where the ban is not in place on music in pubs. Do you think you've made the right decision in insisting on that ban, or possibly might that decision be eased or even changed?
I think we've made the right decision as things stand just now. These decisions are never straightforward and never absolutely black and white. What we're trying to do is balance getting businesses open again with mitigations that guard against transmission running out of control. And we know that indoor hospitality is a higher risk environment for transmission of this virus for a variety of different reasons that I won't repeat, because I've talked about it many times before. And one of the things that is thought perhaps to increase the risk of transmission is people having to shout to make themselves heard. So we've taken a very precautionary position on that right now, and part of the reason for that was the experience in Aberdeen, where nightlife and pubs drove that significant outbreak that's had the whole of Aberdeen in lockdown for 2.5 weeks. But we keep all of this under review. This is a balance we will strive to get right at different stages of this virus, and we understand the economic imperatives here of allowing businesses not only to be open, but allowing businesses to be open and trading as close to normality as possible. But if this virus runs out of control again, we will end up, as Aberdeen has just experienced, these premises having to be closed completely, which is what nobody wants. So I understand how difficult this is for businesses, and that's why we will keep all of this under review and try to get it as right as we possibly can at every stage. Phil McDonald from Global.
Just on the outbreak at Kings Park, given what we know now about the number of cases there, and obviously mandatory face coverings may be coming in as well, do you stand by your position that there's no evidence of transmission of the virus in schools?
What I've said is, thus far, in terms of cases associated with schools that we've been reporting, most of that is transmission in the community that is impacting on schools. I have never said there will not ever be transmission in schools, and it may be that in Kings Park we see some of that, and obviously health protection teams will be looking very carefully at that. So it is not that there is no risk of transmission in schools, but the risk is greater of community transmission getting into schools. But we must have the right mitigations in schools to try to keep the risks of transmission as low as possible, which is why the guidance we will keep under review, and why we're looking at updating part of that with respect to face coverings in secondary schools. Do you want to add anything?
Yeah, I mean, in terms of your question, I'm not sure that any of the guidance that we've ever produced or any of the advice that's ever been released by the Scientific Advisory Group has said that there would be no transmission in schools, because that's just not true. But what we can say is that there are particular age groups where any transmission is much less likely to happen, particularly between children. Now, as children get older, as they get towards adulthood, that risk begins to rise slightly. The greatest risk in relation to schools is the way that virus might be introduced from external sources. What happens in schools will be very much representative of the disease prevalence in the surrounding communities. And as people come close together, we've already seen evidence from house parties, from social gatherings, where the virus has transmitted through those means, and then from there has been introduced to kind of school aged children from that means, rather than directly as a result of contact within schools.
Lindsay Hannah from Borough.
Thanks, First Minister. You'll be aware an open letter was written asking for emergency funding for the comedy sector to prevent the collapse of some venues across the country. The Stand Comedy Club in Glasgow is one of those that said that without the funding, it doesn't know if it will survive. What does the Scottish Government plan on doing about this?
The Culture Secretary addressed this on Friday. We are considering the position. I don't have an update on that today, but we take very seriously the representations that have been made. Comedy is an important art form. It is part of an overall culture and art sector that is very important to the health and well-being of Scotland. So as we do with every other sector, we will consider carefully what further support we can provide. Neil Pooran from PA.
Thanks, First Minister. If I can ask about the return to office work in Scotland, it's currently not scheduled to take place until at least 14th of September. You might be aware of reports that France is mandating the use of masks in offices. Is that something that's being considered by the Scottish Government, and could that potentially allow offices to return more quickly?
I'm not really able to say any more than I've already said about this today. I said last Thursday that we are not given an indicative date at this stage for the opening of non-essential offices and call centres. We will review that at the next review point in 3 weeks, or just under 3 weeks now. And I don't think it would be right for me to speculate beyond that. We will always look at a range of mitigations whenever different parts of society or the economy are opening up. What are the appropriate mitigations in place? And there is, sector-specific guidance in place that will cover all of that. And as we've just illustrated in schools, we keep that under review. But I don't think it's helpful for me to speculate beyond that right now, given that we haven't come to decision points yet. Conor Matchett from the Scotsman.
Just going back to testing and the capacity issues that the government have had over the weekend, are you confident that, as more people get colds, as students go back to university and get freshers flu, as many of us might remember, that the testing capacity in Scotland can cope with that increased level of requirement for testing?
Well, that is what we are working to ensure. We have built up and expanded testing capacity substantially from the outset of this pandemic. We have plans to do so further, and we will continue to develop the capacity and the resilience of the system, because we've always known, which is why at times earlier on, when people would point to what they would describe as the utilisation of capacity, I've often made the point that we are building a capacity not necessarily just to deal with what we face right now, but to deal with what we will face later in the year. I'm not going to say we will not, like all parts of the UK and all countries, not continue to have challenges around all of this, but that's what we are working to ensure. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. On face coverings, if you go ahead with this proposal to make it mandatory for teachers and pupils to wear face coverings in secondary schools, what enforcement action would there be? What would happen if a teacher or pupil refuses to do so? And also, would it apply anywhere in the school grounds, including outdoors?
We'll cover the detail of this when we come to a conclusion. I would anticipate that will be very soon, over literally the next couple of days. This is a recommendation that we are consulting on that will update the guidance. We're not talking at the moment about a mandatory system in the sense of there would be penalties and enforcement in schools. But, I get the sense that schools, while I accept there will be, as there always will be on these issues, a mixture of opinion around it, I get the sense, there's a school here in Edinburgh, I've just read this morning of another couple of schools elsewhere in the country that are themselves deciding to follow this kind of approach. So I would expect schools to follow the guidance on this as they would do on other things. And we'll set out the detail of exactly what is covered on it when we get to the point of finalising the recommendation. Simon Johnson from The Telegraph.
Good afternoon, First Minister. The Parents Campaign Group, Us For Them Scotland, issued a release this morning opposing the introduction of face masks in schools. They were citing Chris Whitty's comments at the weekend that children are very likely to be badly affected by this virus, and arguing that it would cause more harm than good in some pupils, including those with asthma. I'll be grateful for a response to that. And also, secondly, I'd be grateful for a response to the Sunday Post story yesterday, which basically published a letter from Jean Freeman and Cosler to health bosses, I think back in April, which basically praised clinicians over their efforts to clear the delayed discharge cases, and basically urging them to sort of keep going with that. And the article basically said that this showed that political pressure was brought to bear on that transfer of patients into care homes.
Let me take those 2 points separately. I've not seen the specific comments of the campaign group, Us For Them, I think they're called. There will be a mix of opinions on this. I recognise that. I think, though, that is the same campaign group that earlier in the summer, an earlier part of the summer, were encouraging us to get children back to school more on a normal basis. And there will therefore be balances we have to strike there. I think it is really important to have young people in schools, but it is also important if we are to achieve that and continue to achieve that, to keep community transmission low and to have the right mitigations in place in schools. And we have to take account of the latest evidence. And as I say, what I've set out today as the proposition that we are in the final stages of consultation on reflects the most recent World Health Organization advice, which, you know, I think many people would say we should take account of in this. On the Sunday Post issue, there is no contradiction whatsoever between the policy position of reducing delayed discharges, which I will come on to in a second in a bit more detail, and the position that was encapsulated in guidance from March this year for any individual who was being discharged from hospital to a care home to undergo a clinical risk assessment. On the general policy of reducing delayed discharge, there can't be anybody, including you, Simon, who hasn't been aware for years and years and years that it is an objective, not just of the Scottish Government, but governments across the world, to not have older people who don't have a medical need to be in hospital. It is seen as a good thing to get them discharged from hospital into more appropriate care settings. So, you know, the idea that it comes as news to anybody that there was a policy objective on the part of the Scottish Government to reduce delayed discharge, I think is a bit odd. And at the start of this pandemic, we couldn't have been clearer, because the Health Secretary announced it to Parliament that we were seeking to accelerate that process of reducing delayed discharge for all the reasons that we always want to reduce delayed discharge, and usually opposition parties are criticising the government for not doing it quickly enough, but for the added reasons back then that we knew we had to have capacity in our hospitals to deal with COVID, and that with COVID patients potentially coming into hospital, it was even less of an appropriate place for older people to be. So that policy position, I don't think should be news to anybody. But at that point, there was also guidance put in place that in individual cases, clinical risk assessment should be done to make sure that discharge was appropriate in the individual cases. And these two things are perfectly consistent with each other, as the Health Secretary has set out in Parliament and indeed at these briefings on many occasions previously. Kieran Andrews from The Times.
Thank you very much, First Minister. PPE has been sent to dentists that has been repurposed, retested, but some of it had originally expired in 2012. The dentists that are receiving this have voiced their concerns over its suitability, particularly after previous PPE, which had gone through the same process, was found to have disintegrated on nurses and other medical staff's faces while they were using it. Just wanted to know, are you confident that this PPE, which is more than a decade past its original expiry date, is fit for purpose?
Gregor, as CMO, might want to say something here, but and we're always happy to engage with individual groups of clinicians if they have concerns. But again, we've commented on this many times over the past few months. If there is PPE being used that has gone past its expiry date, it is only used when there is a process of revalidation that is undergone, which I think involves revalidation by the Health and Safety Executive. So people shouldn't take, I'm not a clinician, I'm not an expert on these things, people shouldn't just take my word for it. It's the revalidation process that items of PPE go through before they would be put into circulation for use in clinical settings. But we'll always be happy to discuss with and reassure individual groups of clinicians. Gregor.
Yeah, I mean, it's a very rigorous process that any of this equipment goes through to, if it's going to be revalidated. It's led by the Health and Safety Executive, so you can understand the degree to which this is subjected and stress tested, but it's also got public health involvement in it as well. And all those the evidence that relates to the legitimacy of that product being able to be used, I understand, is going to be publicly made available on the NSS website as well.
Christine Lavelle from The Sun.
Thank you, First Minister. You mentioned that there was an exceptional demand for testing over the weekend, and we're hearing from parents and seeing reports on social media that lots of children are picking up colds on their return to school and are now having to get tested for COVID. I don't expect that you would have the exact figures to hand, but have you seen a significant number of children undergoing tests? And should parents be getting COVID tests if their kids have like a blocked nose or a cough? And if so, is there not a risk of the system becoming overwhelmed quite quickly?
So I don't have figures in front of me right now. We have had, and I think this is a phenomenon across the UK, although I'm only talking about Scotland here, obviously. We've had a high demand over the weekend. I used the word exceptional earlier on, don't get too, hung up on that. We've had a higher demand than we've seen over recent times. Anecdotally, I think there is an element there of children who might have picked up colds and sniffles since they've been back to school coming forward for testing. And, that's where I don't have the precise figures in front of me right now, but we'll be looking closely at the reasons and the profile of that higher demand. The advice to everybody right now is that if you have any of the symptoms of COVID, you should come forward for testing, and that applies for parents with children, and that is a new continuous cough, a fever, a high temperature, or a loss of or change in your sense of taste or smell. And of course you can go onto the NHS Inform website, you can phone the line, the telephone number there in order to book a test where you'll be taken through some initial steps. But the advice is very clear that if you have any of these symptoms, you should come forward for testing. Of course, not everybody who has these symptoms will have COVID, and that becomes more likely to be the case as we go further into the autumn and winter, where there will be other viruses and illnesses circulating, so it possibly becomes more likely that if you have any of these symptoms, you have something else rather than COVID. But we still want people to come forward for testing if they have the COVID symptoms, so that if they do have COVID, all of the right protections can then kick in. Do you want to?
I think it's inevitable that as you bring people back together, particularly as you restart schools, you get a rebound in the volume of respiratory symptoms that you see across the country. And, as a GP for many years, that's something that was very common whenever schools went back, was that you sometimes got more kids presenting with those type of respiratory infectious sniffles. What's really important is that if you've got any of the symptoms which may be suggestive of coronavirus, that's the enduring cough, it's a fever, it's a change in the sense of taste or smell, then that's an indication to go and to book a test and to self-isolate until you have got that result. And if that result's positive, then of course you should make sure that you continue to self-isolate for 10 days afterwards. What we are perhaps beginning to see is people who are asymptomatic requesting tests. Now, one of the things I want to emphasise here is if you're asymptomatic, you should only be, at this point in time, you should only be requesting a test if you have been advised to do so by a Test and Protect team, rather than trying to book a test for yourself or your workforce or your work colleagues as well. Only if you've been advised by Test and Protect to book a test if you're asymptomatic should you be putting yourself forward for that just now.
I think that's really important, and it's worth underlining that if you don't have any of the symptoms of COVID, unless, as Gregor says, you are being specifically advised by Test and Protect to go for a test, you shouldn't be booking a test, in order that we make sure the capacity of our testing system is there for those who have symptoms. The other point worth making is that all of the advice that we are asking people to follow to try to reduce the transmission of COVID will also help us reduce the transmission of other illnesses and viruses as well. You know, good hand hygiene, you know, even face coverings. So again, there's secondary benefits to us all following the advice in addition to that primary objective of trying to keep COVID under control. Adele Merson from the P&J.
Thank you, First Minister. Aberdeen City Council leaders have claimed that it took heavy lobbying for the Scottish Government to agree to their request to relax lockdown restrictions. They said that in a 2-hour call, the Chief Medical Officer was still in favour of a more cautious approach and wanted the restrictions phased over a longer period. I was just curious as to why this more cautious approach was initially preferred and what was the sort of deciding factor, I guess, in later going ahead with a more immediate relaxation.
Anybody who thinks that these decisions should be the result of lobbying is frankly coming at this from entirely the wrong perspective. This is an infectious virus where we have to be precautionary in order to keep a virus under control. When we have a cluster, get it under control and stop it seeding widespread community transmission. This is not some kind of political debate backwards and forwards about, you know, who wants to be tough and who wants to be precautionary. We have to take these decisions based on data, based on evidence, and we have to think about them very carefully. So there's been a lot of very careful examination of the data in Aberdeen and more widely in Grampian. We've had to think carefully about the sequencing of lifting restrictions so that we can do that as quickly as possible, but do it in a way that, in relation to hospitality, for example, allows a bit of time for appropriate environmental health checks to be done. We're all trying to achieve the same thing here, and I would really caution against anybody seeing this as, you know, two tiers of government having a clashing of horns or one lobbying the other. For goodness sake, you know, we all have to continue, as we have seen all partners do in Aberdeen, so this is not a criticism of Aberdeen Council, it's a general comment. We all have to work together here with the same objectives in mind and, you know, taking the same precautionary, evidence-led approach.
Yeah, I mean, first I want to start off just by paying tribute to all the teams who've been involved in tackling this Aberdeen outbreak. I mean, I think to be here where we are today, barely 2 incubation cycles into an outbreak, and to have this level of control over it is a real testament to the hard work, the effort and the skill of those teams in bringing this under control. So my thanks to them and for Aberdonians as well for the way that they've responded to the measures. And it is absolutely true to say that last week that I was of the mind that we had to adopt a cautious approach and that we weren't yet ready from the data that I was seeing to be able to make a change in those restrictions. That's why we put in place this midweek review point. That's what it would enable us to get additional information to be able to assess whether the trajectory that we thought that we were on, we had stayed on. And fortunately, that's turned out to be the case. So when we had the discussion yesterday, it was right that we interrogated that data and we interrogated it fully. But at the end of that conversation, both myself and the National Clinical Director were both content to make the recommendations that we did make, which were to begin a relaxation of those restrictions from today.
And I should say, in Aberdeen, just as in all other parts of the country, we'll be looking very closely at the data over the next days and weeks to come, and people should continue to be careful. There is always a degree of risk when you lift restrictions, whether that's part of the national lockdown restrictions or here specifically in Aberdeen. So, you know, continued caution is really important here, and continued adherence to the facts advice in particular. Lastly today, Tom Gordon from the Herald.
Hello, First Minister. Back to face covering in school. Will it broadly be left up to schools to decide how to enforce this measure? And if there are persistent pupils who just do not want to wear these or come from anti-mask families, would exclusion be a possible sanction against pupils who consistently refuse to wear them? And for children who might come from chaotic families whose parents don't do the right thing and supply them with a mask, will schools be resourced to provide masks to those pupils without them?
So on that latter point, that will be one of the things, that is one of the things we're considering about whether, you know, and how schools will have a supply to take account of children who come to school without one for whatever reason. Maybe they just forget to pick it up in the morning. More broadly, you know, schools, stands to reason in an obvious practical sense that we look to schools just as we look to individual businesses to implement the guidance that is in place there. So yes, of course, schools will be in the first analysis responsible for making sure that the guidance is implemented. I don't want us to get into the position here of talking about enforcement or exclusions. There will be, as there is for the regulations on face masks in shops and public transport, for example, there'll be exemptions for children who have a medical reason why they can't wear a face covering. But this is about making sure that we are following the most up-to-date advice to try to minimise the risk of transmission. And the risk of transmission in a school will be slightly greater in a corridor or a communal area where physical distancing is more difficult. But we are, the reason I'm stressing today that we are in the final stages of a consultation on this is because some of these practical issues are ones that we want to make sure that whether it's teachers or local authorities, we have agreement on just exactly how we will implement this, and we'll set out more detail of that over the next, hopefully over the next day or so. That concludes questions for today. My thanks to Gregor for joining me today. My thanks to Jill, our BSL interpreter, and thank you to all of you for joining us. I will leave you with my usual plea to follow the facts advice, face coverings, avoid crowded places, clean your hands and hard surfaces, keep 2 metre distancing as a general rule, and self-isolate if you have symptoms and book a test. And please take the time, if you can, to spread that message to any of your friends, family or colleagues that might not be watching as you are right now. I will be back tomorrow at 12:15 for tomorrow's daily update. But in the meantime, thank you very much for joining us.